Welcome to my presentation on Lacosamide. My student number is u3258222. What is it? Lacosamide is a type of drug that controls seizures and epilepsy in adults and children. It belongs to anticonvulsant medication class. It works by targeting inactivation of voltage-dependent sodium channels in the brain and affects lapso response mediator protons 2, a protein that involves in a neuronal differentiation and anoxal growth, which is deregulated in epilepsy. And mechanism of action. The dosage of lacosamide is 50 mg for children and 100 for adults, administered twice daily. The dose is then increased based on the response, a maximum of 200 to 300 mg twice daily. Mechanism of action is selectively enhanced to slow the inactivation of voltage-gated sodium channels in the brain. These channels are important because they regulate the flow of sodium ion into nerve cells, which are necessary for transmitting electrical signals by improving slow inactivation. Lacosamide helps to stabilize these electrical activities of nerve cells, which lower the abnormal firing of neurons that can result in seizures. These targeted actions on the sodium channels set lacosamide apart from other anti-epileptic medications and helps to control seizures. Pharmacokinetics. Absorption. When dosage is taken orally, it rapidly absorbs 1 to 4 hours after administration. Lacosamide has a high 100% bioactivity, meaning that practically all of the dose is absorbed by the body. Food consumption has a little effect, through it may cause delay in the peak time. Distribution follows after absorption from the gastral tract, where it quickly enters the systematic circulation and spreads widely due to the high lipid solubility. The volume of distribution is approximately 0.6 liters kg, which is closely volume to total body water. Less than 50% of lacosamide is bound to plasma protein. Metabolism. Enzymes break down to produce aldosterone lacosamide, a main pharmacological inactive metabolic in the body. Lacosamide does not undergo enantiomeric intraconversion. It is further broken down into inactive metabolic by contracting with glucuride acid. Excretion. Respiratory excretion and biotransformation are the main ways that lacosamide is removed from the bloodstream. Less than 0.5% of radioactive was recovered in the feces and around 95% in the urine. Following the oral intravenous administration of 100 mg radio-labeled lacosamide after injection, the chemically non-polar component, 20% of its aldosterone metabolic and altered lacosamide was the main substance eliminated. Urine excretion by the kidney is the main method which lacosamide and its metabolites were removed by the body. Lacosamide and its inactivation metabolites are processed by the kidney and eliminated into urine after undergoing a metabolic in the liver. Of lacosamide. It frequently causes headache, nausea, vomiting, double vision, and exhaustion as adverse effects. It could also result as a allergic reaction, mood swing, or issue with coordination. If you have any concerns regarding side effects, it is crucial to speak to a healthcare provider. Contraindications. Some of the examples are hypersensitivity. Use cautiously for treating patients who have significant liver damage. It is important to address any medical conditions. Discuss any worries with a medical provider prior to being treated. Leads to modification in cardiac rhythm. Suddenly stopping the medication can make your seizures worse or return more frequently. Legal, clinical, and ethical considerations. Legal. Lacosamide is included in SUSMP, which stands for the Uniform of Scheduling of Medication and Poison, and it is categorized into Schedule 4 medication, meaning that it is only available by prescription. Some of the prescribers are doctors and nurse practitioner. Clinical. Lacosamide therapy is appropriate for a patient. Healthcare provider must review the patient's medical history, including any corresponding diseases or drugs. Lacosamide patients must be closely monitored in order to maximize seizure control and minimize side effects. Ethical. When it comes to starting and managing lacosamide medication, in a way that best serves the patient's interest. Ethical consideration defines how important it is to prioritize patient safety and well-being. Recap question: what schedule does lacosamide belong to? And does lacosamide only treat seizures? Thank you for listening to my presentation.